Dr. Scott Blyer from Cameo Surgical Center here. Surgery isn't for everyone, and there are some situations where a patient can avoid going under the knife. In this video, I'm going to be demonstrating the non-surgical nose job, or rhinoplasty. Stay tuned.
Come on, do the Humpty Hump. Come on, do the Humpty Hump. Check me out, y'all. Do the Humpty Hump. Just watch me.
Rhinoplasty, also known as a nose job, is a surgical procedure that can be performed in one of two manners. There is an open rhinoplasty, where a small incision is made under the sill of the nose, giving the doctor access to perform the surgery. A closed rhinoplasty is when the incisions are actually made inside the nose, and the surgery is then performed through that access channel. Surgery is needed to address problems to improve breathing, to narrow a fuller tip, or take down a bump, to name a few. There are situations where a filler can be used to camouflage or correct a problem without surgery. This is especially true for a revision rhinoplasty, which can be complicated. When a blade was used for someone's first rhinoplasty, I always preferred to use a syringe for someone's second rhinoplasty. Fillers like Juvederm, Restylane, Perlane, or even injectable silicone can be used, but in this situation, for this patient, I used Radiesse. When this patient presented to my office, she was complaining about a bump on her nose. At quick glance, it does appear to be an area which should be addressed. It is important to evaluate where is the root of the nose, or where does it begin. This position is known as nasion, and its ideal position is at the mid-pupillary line, meaning at the level of the center of the eye, and on the average projects about 10 millimeters, more specifically 0.28% of the nasal length. Looking at this patient, she does have a bump on her nose, but she also has a very deep radix, which makes the bump appear even more dramatic. In my office, I often use prediction software to demonstrate my plan to a patient. Ideal treatment would be a surgical rhinoplasty to reduce the bump and graft the radix to sort of split the difference. This patient did not want to have surgery, so we agreed on a non-surgical rhinoplasty, and again in this patient we used the filler known as Radiesse. There is no downtime to this, and the results we anticipate should last about 2 years or so. The reason we chose Radiesse is that Radiesse lasts for about 15 months, but in this area, like the nose, which is not a very mobile area, this product will remain even longer. Radiesse also has more fortitude and is firmer than the other fillers. This area is occupied typically by bone, so a firmer filler would be a more natural result. The procedure is quick, essentially painless, with little to no downtime. The results are long-lasting, and for some people may be life-changing. If you have a nose like this, or know someone who does, what are you waiting for? Please share this video to someone who may benefit from this simple procedure. A simple click can potentially improve someone's life. Dr. Blyer signing out. Thank you.